we now turn to part 2 of the bill, including the Honourable Annick King's amendments to that part. The question is that part 2 stand part.
Mr. Chairman.
Annick King, the Honourable Annick King again.
Mr. Chairman, yes, this is the part of the bill that I don't agree with the Minister's decision. And in fact, we have a minority report from Labour, from New Zealand First and the Greens in relation to this part of the bill. As the bill was introduced in part 2, the Minister wished to ban sunbeds for young people under 18 years of age. We had many submissions, Mr. Chairman, on this part of the bill, and practically every one of them thought that we could do much better. They thought we could do much better because of the very strong evidence that sunbeds are very bad for the health of New Zealanders. In fact, we believe, well, we don't believe, we were told that sunbeds are responsible increase the risk of people getting melanoma by 75%. Increase the risk of getting melanoma by 75%. So you have to ask yourself, why would we continue to allow the commercial use of sunbeds in New Zealand? Don't we, in a public health approach, try to minimise the risk to New Zealanders? Isn't that the very approach that we've taken with tobacco, requiring people to wear helmets when they're on their bikes? Think of the range of measures that we've put in place to protect the health of New Zealanders. So what we did at the Select Committee, we put in a minority report and said we believe that sunbeds should be banned in New Zealand except for medical purposes. And that is what my supplementary order paper, which has been available for quite some time now, has been, in fact, since the 20th of May last year, my supplementary order paper has been available. And what it does is it bans the use of commercial sunbeds except for medical purposes. And the reason we did that was based on the evidence that was provided to the Select Committee. I can see no good use of sunbeds for commercial purposes for New Zealand at all. And in fact, I brought down one of the submissions that I think was important because of their dealings with patients, and that is the submission from the New Zealand Medical Association. And the New Zealand Medical Association is supportive, this is their words, of a complete ban of the use of commercial UV tanning services for cosmetic purposes. And we ask the committee that the committee gives this recommendation serious consideration during its deliberation. Well, in fact, we did give it serious consideration, and 3 parties said we want to ban them. Unfortunately, that was not the view of the government members or the Minister. I have to say that I have great respect for our health officials. They do a great job. But their regulatory impact statement is a great disappointment to me. And when you read their regulatory impact statement, you'd have to think that it's more important to the Ministry of Health to ensure that people's rights to have a tanning machine is more important than the health of New Zealanders, because they set out their objectives against which the policy options could be assessed. And they say this is what they are, that they developed them against which policy options could be assessed, and they included to prevent and reduce the risk of public harm from commercial sunbeds. Tick. You couldn't disagree. That any new controls or interventions for this purpose need to be risk and evidence-based. Risk and evidence-based, and good international practice Risk and evidence base was provided to the Select Committee as to why these are not good for the health of New Zealanders. And of course, as we know, that the WHO themselves have made their own comments on this. They have believed that they are carcinogenic, Mr Chairman.
The Honourable Annette King.
The third objective is the appropriate protection of the health and safety while still enabling the medical UV devices for the treatment of certain skin conditions. Tick. Agree. Then the next one, not impose unnecessary or unjustified compliance cost. Well, if they're banned, I doubt whether there's a hell of a lot of cost or need to have inspection, to have codes of conduct. They are just banned. And the last one, this is the one that I really found offensive. Not necessarily restrict access to services desired by well-informed adults unless there's a good reason. Why do we have legislation, regulation, taxation on tobacco? Because surely these are well-informed adults. Surely they want to keep smoking. That's their choice if you were to read this. Why restrict access? You see, it doesn't add up. And I'm going to say this, and people might disagree. I don't believe this is what the Ministry of Health think. I also know officials in the Ministry of Health. They are good public health people. I don't believe this is what they wanted. This is what's provided, but it's certainly not good public health practice. It is certainly not what a forward-looking government would put in place. It's interesting, Mr Chairman, that Australia, a country I don't believe usually outstrips us when it comes to health policy. In fact, they are slow followers of New Zealand in the main. Interestingly, they have banned the commercial use of sunbeds.
Oh, really?
And they were banned, and they took effect from the 1st of January this year. One of the things that we were told at the Select Committee was that the used sunbeds from Australia were heading to New Zealand so that we can give melanoma to our people because they don't want it over there. And it's also an irony to me. The government has announced $39 million of new expenditure for Pharmac, which the Minister said much is going to a new melanoma drug called Opdivo. At the same time, we're not prepared to ban sunbeds, which, as I said to you, they increase the risk of getting melanoma by 75%. It doesn't add up, Mr Chairman. Why haven't we got the courage of our convictions to say we will ban them? My bill enables 3 years to phase out. It gives the commercial operators the opportunity to change what they are doing. It's not unreasonable, but it is a good public health measure. I feel strongly about this, Mr Chairman, and so have so many people who have contacted us, particularly those who work in public health, and including doctors, nurses, specialists. It is, to me, a mystery as to why we haven't gone the whole hog. Instead, what we are doing is that we're banning it for those under 18 years of age. Melanoma doesn't just stop for those under the age of 18 years. Unfortunately, melanoma is actually a problem for young people, yes, but they are older than 18 who also get melanoma. So, Mr Chairman, I'm very sorry that we have not been able to achieve an ultimate outcome in this bill. We certainly did an excellent job in part 1. This is a disappointment from part 2, and I don't care if there are those that say such a supplementary order paper as mine is nanny state. I'm over this nanny state stuff. I'm over putting that up as an argument when we should be protecting the public health of New Zealanders rather than allowing the continuation of a practice that leads, when used, to 75% of New Zealanders likely to get melanoma. So, Mr Chairman, we will vote for this bill, but now the Minister is arriving in the chair, and he is a person He probably missed the slight praise I gave him a wee while ago, so I'm happy to repeat it, that he did act quickly on Part A when we made an amendment to it, but he has not been moved to change the position on sunbeds to ban them. I urge the Minister to rethink it so that it's not his legacy that he finishes as Minister of Health having the opportunity to fix something but didn't do it.
Ria Bond.